So good evening, everyone, and thank you for joining us in this informative and supportive webinar. So my name is Alfonso Aguaron, and I'm very glad to be your moderator today. Today, we have a remarkable speaker with us, Dr. Valeria Sebri, who is Doctor of Psychology at the Applied Research Unit of Health, Cognitive and Psychological Science at the Istituto Europeo de Oncologia, the IEO, in Milano. And also, Dr. Sebri is also a member of the ITRELAN Consortium, in which Luce is also a partner. So her expertise in this field is truly invaluable, and we really appreciate, Valeria, you taking the time to guide us through this important topic. So before we begin, let me give you a brief overview of the session dynamics. So the session will last for about an hour. And in this first part, Valeria will provide us with a comprehensive review of today's topic, which will take approximately 30 to 40 minutes. And during the second part, you will have the opportunity to ask your questions. We really encourage you to have an active participation, and to do so, you can ask your question in two different ways. So one of them is by raising your hand to speak live. When it is your time, I'll unmute your microphone so you can make your question by voice. Or if you prefer that, you can type your questions in the chat or in the Q&A window, and I'll make sure to pass them to Valeria so she can address them. We have also made sure to provide live transcription for accessibility, so you can enable the live transcription in the bottom bar. So without further ado, let's dive into this very insightful session. We hope you find it valuable and leave with deeper understanding of coping with lung cancer diagnosis. So Valeria, when you want, the floor is yours. You can share your screen and start your presentation.
Okay, thank you. And thank you all for being here. I'm sharing my screen. Okay, so thank you again for being here for my presentation. As said by Alfonso, today I'm glad to speak about coping with lung cancer diagnosis, and in particular, I will focus my attention on the body, the social and the emotional impact that lung cancer has on patients. As a summary, we will speak about an overall introduction about lung cancer and its impact on emotions and also physical variables. And therefore, we will speak about the social relationships that change during and after the illness. And as a consequence, I will address family and couples difficulties, because as we know, there are also consequences on social relationships and intimacy, I mean. At the end, I will present available psychological interventions that the literature presents as efficacy in order to address these particular difficulties for lung cancer patients. So what about an overall introduction? Speaking about a background, we have to know that the literature presents long-term physical, psychological, cognitive, and also social effects due to the diagnosis of cancer, but also its related treatments. So we have to speak about the chemotherapy, radiotherapy, and all the treatments that have a lot of consequences on the physical and also on emotion. In particular, we have to know that body changes after oncological treatments. So patients presented, for example, scarrings, but also in general, the overall perception of the body change. And in association with these, negative emotions increase. When we speak about lung cancer, we have to address negative emotions in terms of anxiety and depression in particular, but also distress is a relevant emotion that have to be addressed. And another interesting point in terms of an overall introduction are expectations and future goals. Patients have to reframe their expectation, have to change their goals in terms of individual dreams, but also goals that could be related to the overall family. And another interesting point that have to be considered is the relationship with the doctors. In particular, in reference to this point, I conducted some interviews with lung cancer patients who expressed their difficulties in the communication with their doctors. And these kind of troubles were the consequences of low involvement of family members. So patients presented the need to involve caregivers in order to have a sort of support during the medical consultations. And also another interesting point that they reported was the lack of empathy. So patients say that doctors are sometimes too much involved in the commitment to discuss about illness, about their physical consequences, but patients ask for more empathy. So the perception of being in a relationship with doctors is essential. And accordingly, patients speak about the time dedicated for medical consultation in order to express their desire to make it longer. So patients presented the fact that the time sometimes is not sufficient in order to express their needs, express their doubts, and to have at least a more complex and complete discussion with their doctors. So starting from physical variables, what are the main consequences on the body after diagnosis? When we speak about physical variables, we have to consider, of course, the aesthetical appearance. So oncological treatments lead to undesirable appearance-related side effects in terms of scarring, but also hair loss. At the same time, another level of interest is interoception. What is interoception? Interoception is defined as the perception of inner sensation, such as the source of danger and worry. And in particular, when we speak about interoception, we address also the fear of cancer recurrence. So the point is that patients have the tendency to have more inner sensations, and sometimes they are linked to the fear of cancer recurrence. And in association with this, illness can become a status of mind. So people do not perceive themselves as people, but as illness people. And it could be a point of interest that have to be addressed, because if I perceive myself as a patient, as not as a person, also my behaviors will follow the perception that I have with my ill body. And addressing this point, we have to consider the concept and the definition of body image. Body image is not just the aesthetical appearance, so the fact that I like or I don't like my body, but is the mental representation of my body. And this way it involves my emotions and also the overall sense of my bodily self, so the self-representation that is linked to the body. Speaking about self-representation, we have to say that not all patients always negatively have a self-representation of themselves. So we have also to consider a valuable and possible adverse condition that could lead to increase negative patient representation after and during cancer. This way, people can create idealized models of symptoms in order to provide personal representation of the disease, and in order to cope with these variables, we have to we have to involve the coping abilities of each patient that have relevant consequences on treatment adherence and the overall quality of life. Also, literature address the need to study coping and in particular skills, individual skills that each patient have to address the illness. And as presented in this slide, we know that coping and self-efficacy can mediate the impact of resilience on psychological well-being, but also the fact that higher level of resilience are in combination with self-efficacy in order to have better overall outcomes. Second, we have to address the level of emotions. So what about emotions? It is important to divide the discussion about emotions also in reference to the different stages of illness. So starting from the diagnosis, we have to consider it as a shock. So patients, when receive a diagnosis of cancer, sometimes they did not feel themselves as sick, or sometimes they did not present physical symptoms. This way, diagnosis could be a very, very strong shock, because they have to accept that something is wrong, and but they have not symptoms in some cases, or in other cases symptoms are present, but I have to accept that there is a new path, that I have to address a long journey in order to address my illness. On a second level, we know that the most important emotion are sadness and anxiety. And when I say that are important, I mean that they have a very strong impact on the overall well-being, also in terms of physical reaction to cancer. And they are very important also to accept the cancer condition, so the fact that I have to struggle with this illness. And when we speak with patients about it, they reported high level of fear and anger, because they perceive physical limitation and also the need of having a time to accept the diagnosis at all. So in order to summarize the main emotions, we have, of course, frustration. So that is a consequence of the fact that the patient has not, there is a lack of certainty, and also the alteration of personal and future goals. At the same time, patient reported unmet needs. So the perception that the needs not even are addressed as they would like to be. Anxiety and depression, I already said, but also isolation. So in terms of social relationship, patients perceive that the others are distant from them. And in general, they reported the perception of being isolated from society, and sometimes also from their intimate relationships. This is a European scientific publication in which there is a scientific background regarding the high presence of negative emotion in lung cancer patients, and in particular, these articles presented results regarding depression, anxiety, distress, but also a high level of a poor quality of life. So regarding social relationship, we already said something in terms of, okay, cancer can affect social relationship, but why and how these social contexts are important? First of all, after a cancer diagnosis, and in particular a lung cancer diagnosis, we can observe a decreased support over time. So, at the first time, patient reported that there is support, so they perceive support from their families, from their caregivers, and also from the people in general. But this support does not last over time. So over time, over years, for example, such a support decreases. And this is at the same time also associated with the reduction of social contacts that patients act in first person, because patients reported that they perceive shame of their illness condition. So they try to be isolated, and also they perceive to be alone in front of the others. And this way we can say that there is a stronger, a very different value of friendship, because people who are considered friends before cancer, after diagnosis and during oncological treatment, can change in their definition as friends. And as I said before, there is a strong relevant impact of the perception of being a patient and not a person. And this impact is so relevant also in terms of social relationships. Because if I perceive myself as a patient, I maybe in some cases, I might prefer to stay in contact with, for example, other patients, because I have the perception that they can understand better my condition. And so social relationship, and in particular people who, for example, met some before cancer, could not, for example, in these cases, the people that I want to meet in this phase of my illness. The third point that is really important is the back at work. So we have to consider that in terms of social support, and also in terms of social contacts, the illness leads to the impossibility to stay at work. And there is also a very hard fatigue in terms of try to back at work. Oncological treatment, of course, lead to strong consequences on concentration and attention, so cognitive skills in general are impaired, and lung cancer patients, and in particular survivors in this case, have to stay focused on this point, because maybe they try to do something as before cancer, but they have to consider that, for example, attention is not the same as before cancer. And this is in line with the overall desire to come back to the life before cancer. So the desire to be the same as the cancer did not came, but we have on a psychological level, it is strongly important that the patient can accept their illness condition, and also the cognitive consequences that can be a result. And the first point that we have to consider in terms of social content is also the tendency to self-scrutinize themselves continuously in order to compare my body image and my own perception with the cultural stereotypes in reference to physical appearance. So we observed, and also literature confirmed this point, that patients continuously compare themselves with the others. And of course, differences between the that come from social society. I mean, this can make a very strong impact on emotions, because if I perceive this strong difference, I will tend to be more sad, or in general not satisfied for this perception about myself. And then we have to address also the contents related to family and couples, and in particular with the word that cover all intimate relationships. As known, when we speak about cancer, we have to consider also all the whole family. Today, a part of literature say that it is impossible to think that cancer is associated only to an individual. The cancer involves all the family members. And this is true in terms of emotional reactions. So, for example, distress is related to the patient itself, but also to caregivers and the family members at all. This way, lung cancer affects intimate relationships because the routine of patients, but also of his or her caregiver, changes strongly. For example, in terms of less time spent with the family, or also the inability to perform some tasks related to household. And so caregivers have to start with new skills, have to start with new tasks in order to help their loved ones, and in order to also try to address the cancer for all the family members. And these changes sometimes cause frustration in both patients and partners. Why? Because patients sometimes do not want to be a problem for the partners, so they try to be autonomous, independent, but they not even have the possibility, the resources to do it. On the other hand, there are partners who can face some difficulties in order to cover also the role of their partners as before cancer. So it's clear that the quality of family relational functioning can affect the adjustment to the illness. And another interesting and very relevant point is the level of resilience, the family resilience, that can also affect patient outcomes in terms of physical results, but also emotional outcomes. So the approach of the family in terms of coping and strategies to cope with cancer can also have consequences on the patient outcomes in terms of, for example, of treatment adherence and the overall quality of life. This way, these are 6 main relevant points to take into consideration when we speak about family and patient with cancer. So the fact that cancer breaks the individual and family life balance, so people have to reorganize the family rules and also the routine, and everyday life in general must be reorganized. And also that the disease concerns the family at all. So it is not just, as I said before, a difficult and emotional trouble of the patient, but it involves all family members. And this way also the family has to involve its resources to face with this new condition, and how it could be do. For example, we could think to the effective communication and the possibility to share therapeutic choices in order to promote a psychological adaptation to the disease. And this is an example, a very relevant example, I mean, when we have to think to how family can be helpful for the patient itself, but also for the reorganization of the family and its role. Indeed, changing roles within the family is one of the main points that have to be addressed, because the patient not always can address the role, the skills as before cancer. But at the same time, it could be important to try to maintain a routine in order to return to normality when it could be possible. And at the same time, it is impossible to define new emotions, because in these cases, patients and family members can perceive a new emotion that they didn't know before cancer. And so there is also a journey to know this new emotion and to accept them. But what I want to highlight is that cancer does not define the family. So we have to even consider that we are people, we have families, and cancer does not define them. Because if we have the level of patient, if we have the level of family with cancer, there are a lot of consequences about it, because people start to behave as patient at all. And it is more difficult to maintain a routine, to come back to normality when possible, but also to only apply some resources, because maybe anxiety is too high, and also other negative emotion in other cases. This way, psychological studies suggest to increase some strategies, such as increase, promote, and active listening within the family. For example, the relevance of hidden messages have to be addressed, because sometimes, in order to do not worry the others, some messages are hidden, but it could increase anxiety and distress within families. At the same time, another suggestion is to focus on short-term goals. So it's clear that priorities changes after and during cancer. So the suggestion is to try to focus on short-term goals in order to have the possibility to achieve also some aims and some goals. At the same time, we have to consider the promotion of sexuality and the communication on intimacy in particular, as no oncological treatments affect sexuality. And so another interesting and important point is to address this part and do not consider that it is not important, because it is fundamental for the couples. So also in case of cancer, it maintains its relevance and have to be addressed. And lastly, also the communication in terms of expression of needs and emotions. Lastly, what are the main psychological interventions? In particular, we have to start with addressing emotions, so the importance of deal with the fear of cancer recurrence, and the importance of recognize emotions. And second, the psychological intervention have to be addressed on the promotion of body compassion, and also the promotion of physical activities and sport in order to promote the overall physical well-being. And also psychological intervention have to improve relationships in order to avoid misunderstanding, and also to decrease other judgments or even the perception of it. These are some of the main sentences that patients and also caregivers reported to us as psychologists. For example, some difficulties could, as the result of the inability to accept the illness. So there is a tentative of denial, but also the problem related to the family could be the caregiver are hyper involved, and so patients try to make a distance with them because they say, I am only the patient. So the idea is that psychological intervention could have a role also to make a balance between the roles within a family. And so in conclusion, what we can affirm and maintain as an overall message is that both patient and their family have to be supported over patient journey. And in order to do this, as psychologists say that coping and positive communication are fundamental for family members, but also patients in terms of psychological well-being, but also if we want to increase physical outcomes. So the idea is that the psychological intervention have to be implemented in order to prevent dysfunctional adaptation and not just to solve some current problems. So the idea is that, okay, we have to start before we have to implement psychological intervention that can address since the diagnosis possible dysfunctional adaptation that could appear during a patient journey. And that's all. So thank you all. And if you have any doubts or question, please feel free to say me.
Thank you so much, Valeria and Jessica. Oh, okay, that's it. The presentation is not closed, so we can see in full screen. So yeah, well, thank you for this very brief but comprehensive presentation. I think you have covered many topics about the impact, not only on the physical side, but also the social, the psychological. And we have been already receiving some questions from our attendees, but I would like to remind our audience, especially those who joined after the presentation started, that you can keep on sending your questions, writing them on the Q&A or in the chat window, and I'll read them to Valeria, or raising your hand so I can unmute you if when it is your turn. So I'm going to start. I'm just opening the chat here in the Q&A. So I'm going to start with the first question, Valeria, who says, from your experience working at the IEO, do you feel that there is a growing number of centers which are able to provide a holistic care to lung cancer patients in terms of treating the disease as a whole, and not just the physical side of things, but also treating the psychological and the social burden that the disease can generate?
Yeah, thank you for this very interesting and relevant question, because it is very current. I mean, in the current background, yes, I can say that now there is even more tendency to increase the complementary therapies that try to address the physical troubles and the physical difficulties, but also the psychological troubles. And in these terms, I think that the overall background associated with lung cancer has even more specific focus on the patient at all. So we try to address all levels of the patient well-being. There is the body, of course, that's the first point of interest, but there are also emotions, and there is also nutrition, for example. So there are also other therapies that are correlated to the good food that a patient could eat or is suggested to be avoided. So yes, I can say that I think, and also literature confirm it, that now there is even more tendency to have a very complex idea of the illness that is not only related to the body itself, but to try to embrace all the patient needs and also desire for the future.
Great, thank you so much. And here is a question. It's not the second one that I received, but probably I should have done this before. But I think it's better that you answer that, because you have of course, a clear idea, which is, what is the exact role of the European Institute of Oncology? So maybe you would like to introduce a little bit your institution that you work for.
Mm-hmm. What is the role in terms of, sorry?
What is the exact role? What does the IEO does? You know, I know it's a very big institute which covers a lot of things, but maybe you would like to introduce how it works and what's the exact role of the psychology unit in which you work.
Yeah. Okay. Yeah, I work at the European Institute of Oncology. That is an hospital that is focused specifically on cancer and different types of cancer, of course. And as psychologists, we are involved in the care of emotions in terms of, in order to address the emotions at the time of diagnosis, but also during the patient journey. So we are divided into researchers at all, but also clinicians, who are the main people, the main professionals that are called to address emotional troubles. So in general, when a patient achieve the hospital, the physician or someone else propose to patient to start psychological sessions or just to see a psychologist for a first time in order to discuss and share their emotions. So patients have the possibility to accept or not this proposal. And in this case, there is also the possibility to start a very journey with patients. So a sort of path that patient can do with us. And yeah, there are some meetings. And what I think that is a novelty of these years is also the possibility to have online meetings, virtual meetings, that is a result of the COVID-19 emergency, but it is also a very important possibility that we can give to also people who do not live close to the hospital, because as a European hospital, we have patients from all over the Europe, but also all over the Italy. So sometimes patients achieve the hospital in Milan for the main phase of oncological treatment, but in order to maintain a psychological support, we have to maintain these contacts, and in order to make it easier, the virtual meetings are a feasible and a very useful possibility.
And yeah, just to add up on that, I have to say that having the luck of working together with you in this European Union project, which is called Lifeline, I think the IO represents one of the state-of-the-art centers, not just for Italy, but also across Europe, in terms of not just the clinics, but also the research on what you're doing at the psychology in cancer. So we're very lucky to have you today. Okay, so let's go for the next question, which is about, I think this is a very interesting question. Someone is asking, do you think that the stage and type of lung cancer has a major impact on the road to acceptance that you were mentioning during the diagnosis, or would you consider that there are other factors that are more relevant? So I think this person is meaning about, whether a patient with a non-small cell compared to a small cell, or whether the disease is located or advanced makes a complete different thing when the patient has to accept, or whether you find that there are some other factors which might be at least of the same relevance.
Acceptance is I mean, a very, very important but also complex concept to be defined, because each person has a different approach to the possibility to accept his or her diagnosis. So I think, and the literature of course says that the stage, for example, of the cancer, so having a stage 1 of the illness compared to an advanced form of lung cancer can have an impact on the difficulties to accept the illness itself. But at the same time, we have to consider that each person has a very individual and personal approach to the acceptance of the illness. So there are people that, for example, say, okay, it's not important for me in terms that I have fear, but I want to deal with it. So I don't want to think about it. I want to follow my oncological treatments, and then maybe in a second time I will reflect on all these things. So in this case, we don't say that there is an overall acceptance of illness, but there is the tendency, the tentative to address it as the first point. There are other people who have the need to stay quiet, to have a time to reflect about what is happening. So in this case, it could be the possibility of an elaboration of what is happening, so the cancer diagnosis and all the future requirements that will arrive. But yeah, we could affirm that in this case there is the space of a reflection, and so the possibility to elaborate and then accept the illness. But we don't be sure about it, because also having a time to reflect on cancer is not the we have not the certainty that this time could be used in an effective way. So people could use this time just to increase their anxiety and also sad about it. So acceptance is very complex, because what I want to say is that each person has a different approach, so there are not specific variables. Of course, we know that in case of advanced lung cancer, it could be more difficult. It's clear. Or also other variables could be the lack of social support. When we know that there are caregivers or family members in general that follow patients, we have in general the perception that it could be an helpful and it could be helpful for patients. So yes, in general we can say that this patient could be could have less difficulties in order to accept his or her illness, because they could be helped by their caregivers. But also in this case, we have not to be sure, because there are also literature show that there are dysfunctional types of social support. So sometimes caregivers and family members do not help patients, but became an obstacle in order to accept illness. So I know that the response to this question is very complex and maybe impossible to be provided. But what I mean is that, yeah, we started to address what is the characteristic of the illness at the first sight. But then we have to consider individual emotion, we have to consider the family characteristics, so the presence or the lack of caregivers, and also what are the main coping strategies that characterize these specific patients. So the tendency to avoid, the tendency to cope with a problem, and these are some of the main area of topics. But of course, we have to personalize intervention and to tailor all of the contents on the person itself.
Yeah, thank you so much. And I think that the next question really links well with this last part of your answer, because another attendee is asking, are there any identified population which have a poorer coping with the disease? And I mean, speaking on demographic factors like the level of income or education, country of residence, just to mention a few. So have you identified in your research if there are particular types of people who might be more challenging to cope with the diagnosis of a lung cancer?
Thank you again. This is another very interesting question, because yes, I explored this point in one of my study research some years ago, and it is very interesting because what we discovered was that there is not a general rule, in terms that sometimes people who have, for example, an higher level of education could perceive more distress about cancer. And why happening it? Because this type of people, so they have higher education, could lead people to be more aware about what is happening. So people could have the difficulty to accept it, and there could be also more fear about oncological treatments, because they know they have an education that lead them to know, to understand, and sometimes also hope is impaired, because people define themselves as patient at all, and they decide that they have no other possibility because they know what is lung cancer, they know oncological treatments. So on an emotional level, it could be a problem. At the same time, we have also the fact that other people with, for example, higher education could, because they are very aware about cancer and its treatment, they could be more motivated to address it, to deal with cancer, and they also know what could happen, for example, after a chemotherapy. And this, on the other side, it's the contrary, I mean, because in this case, people use their intellectual context in order to face difficulties, in order to prepare themselves in front of the oncological consequences, I mean. On the contrary, in terms of education, people who have a less level of education could be not sufficient prepared in terms of oncological consequences, and so the result, the outcomes on a physical and emotional level could be disrupted for them. On the other side, in terms of geographical belonging, in this case, it is difficult to define it because it is strongly related to each country. So what I can say is more associated with, for example, some type of society in which there is the tendency to share emotion, or type of societies in which the tendency is to be isolated and to do not share what is happening. So also in this case, there is not a unique rule and a unique response. But there are collectivistic societies in which the possibility to share their emotions lead also to a decreased level of shame, because I'm satisfied by myself, and I have not the fear to be different from the others, because I have this possibility to share my emotion, and I have not the perception of shame compared to the others. While on the contrary, there are more individualistic society in which the tendency to be isolated could make more difficult to address cancer, and also the possibility to increase negative emotion could be promoted. So the individual characteristics and the social demographical characteristics are strongly relevant, but also in this case, we have to collect all this data and then associate them to the patient and his or her characteristic in order to have an overall overview about him or her.
Yeah, absolutely. And just to add up on what you said, I think if our attendees are interested in some of the reports that we published in the past, I especially suggest you to go to the bibliography we included in the fourth report of Luce, which was around early diagnosis and screening. And some of the tests that we were analyzing were some interventional and pilot studies that were done in certain economically depressed areas in the United Kingdom, in which people tends to have lower income, higher smoking habits, and how implementing screening and awareness in the local GP centers lead to have a higher number of diagnoses. But you know, it was like, as you well said, first of all, understanding the global demographics, and then have very tailored interventions which are going to really help reducing the problem, or at least tackling the problem in the best way possible, depending on the characteristics of these populations of this area. So yeah, there are some studies out there, but of course it's difficult to have a systematic approach. Okay, so we still have time for a few more questions. Okay, so this is a question coming from a caregiver. which is saying, as a caregiver, I feel sometimes being kept apart from my father's health decisions or journeys. So the father is the one who is diagnosed with lung cancer. And say, I do understand that he's the one directly suffering the effects of the disease, but I also feel my life has changed completely, as I need to take care of appointments, have some work leaks to accompany him to the hospital, which is far away from my house and his village, and also is leading to some issues within the family. The hospital is not offering support to me, even though I feel my life has changed completely. So the question is, what could be your advice so I can deal better with the situation? I feel sadness, anger, and also that nobody really has a sense on how the whole thing is impacting not just my father, but me, my brother, my kids, and my husband. Where can I look for help? And I think this really relates to the fact that sometimes probably the caregivers are a little bit on the background, even though they may have their own challenges and issues when a diagnosis impacts the whole family.
Yeah. I totally agree. And as I said before, the cancer affects the family at all, and not only the patient. So what I can suggest is to also maybe to follow some psychological sessions also for caregivers and other family members. I know that it is not easy to do because commitment and difficult to cope are already very high, and there are a lot of things to do. But I can affirm that when also the family stay well in terms of psychological reactions and emotions at all, it gives also the possibility to patient to be more to stay quiet, to do not have the perception of have an impact on the family at all. So the point is that as I said during the presentation, also the family is affected by cancer and its consequences, and we have to start with a new sort of state of mind, that also the caregiver can be supported by psychological support and by professionals who can embrace their emotions, and this has consequences on the family at all, also the patient in terms of treatment adherence and the overall physical well-being. So my only suggestion in this, of course, brief time to discuss it, but is to reflect about the possibility to be followed, to be supported by a psycho-oncologist into the hospital if possible, but also in another clinical place if maybe it is more feasible, and provide more possibilities for the family itself. I add just another point. I don't know if sometimes people do not know it, but there is also the possibility to follow up psychological session in which all family members follow this session together. So this is a very important point, because people sometimes know that there are also only individual psychological sessions, but specifically also in case of cancer and cancer situations, also the family altogether can participate in a psychological sessions. And this could be another relevant point, because in this case, the focus is on the family and on the dynamics that that could be a consequence of the cancer. So the family members all together can speak with a professional who can try to help them to address and deal with cancer, and in general the relationships that derive from the cancer situation.
So I think you just read the mind of another caregiver who was asking us something very related to what you just answered, which is about this family intervention. So she says, my mother has been recently diagnosed with a stage 4 non-small cell lung cancer. it's been quite a shock to the family, and doctors have said that she has a mutation, so she can receive oral treatment, but she's feeling weak, so we all need to readapt our habits. And she says, however, some of my family, especially my sister and her husband, are denying the situation, even though a hypothetical is falling through the whole family. And she says, I'm thinking about asking an intervention, but I have fear about their reaction. I'm just trying to find the best solution so we can all adapt to this new situation and challenges. And she's asking, would you recommend looking for a mediator or a family psychologist to intermediate so they don't feel directly confronted by the other members of the family who are more willing to help? Or would it be better not to count on them at this point and just come with the members of the family who want to support and help? No, it's difficult to answer, but they are mentioning this kind of group family therapy altogether and not just on an individual basis. So if you can elaborate a little bit more on this type of intervention, maybe this can help a little bit more to this person.
Yeah, of course. And yeah, it's not easy to respond also because I don't know the specific dynamics of this family. So we have to consider that the life does not start with cancer. So when we speak about the family dynamics, we have also to consider what kind of behaviors happened before cancer, because this influences also the reaction to the illness when arrive a diagnosis. A part of this, what I can say is that if I have the perception of being the only person that has resources to address the cancer in terms of difficulties, emotional reaction, and emotional troubles that are coming, I will suggest to maybe start at the first sight an individual session, an individual journey of psychological support in order also to better explore how to involve the other people of my family, the other family members, or even in order to, in some cases, accept that the others do not want to be involved, because there are cases in which denial is very, very strong, and we can oblige other people to be involved or to accept that the situation have to be seen and that have to be addressed. So my suggestion is to start with an attention on ourselves. So ourselves in terms of what I am feeling about it. Yeah, I know that my other family members do not want to address this point. Okay, I can start with myself. I can start with my emotion and my difficulties. Also addressing the point that I am angry with them. I can accept it. So the point is that start from you, start from your emotion, and then step by step, with the support of a professional, it is possible to reflect about how the family could be involved. Or in any cases, we have to say that there are situations in which the others do not want to be involved, and we can oblige it. But also in this case, a psychological support could help also the person who is the caregiver in this case to accept it, and so to promote the overall psychological well-being, because yeah, the level of distress in terms of caused by the other absence of support could decrease, because I promote myself, and yeah, I can also accept that the others do not want to do the same things as me. But my suggestion is to start with yourself, start with us.
Great. So it seems that we are almost on time. There are a few more questions that probably, in the interest of time and also to finish at 2 as planned, we are going to break now. And so we have reached the end of our time together. And before we wrap, Valeria, would really like to extend my heartfelt gratitude to you for your outstanding presentation on behalf of the full Lung Cancer Europe team. As always, it's a pleasure to work together with you. And I'm really confident that our attendees found it exceptionally informative and valuable. So I would also like to express our appreciation to each and every one of you joining us in this webinar. And remember that this entire session, Valeria has given us the permission to share the recording with you, and it will be shortly available on our YouTube channel. So all of those attending, you'll receive an email notification as soon as it is uploaded to our YouTube channel and into our social media channels. So you will be able to revisit and share this valuable content with anyone you feel is convenient. I also like to take this opportunity to encourage you to stay connected with the Lung Cancer Europe by visiting our website, also the Istituto Europeo de Oncologia and the i3Lung initiative, and the social media channels such as Facebook, Twitter, LinkedIn, Instagram. And so this way you can stay updated on the latest activities and events. So with that said, I wish you all a very highly productive and enlightening evening. Again, Valeria, thank you so much. And we eagerly anticipate seeing you in the upcoming webinars. So thank you for your participation and have a wonderful evening. Thank you again, Valeria.
Thank you too.
Bye-bye.